BGS ಗ್ಲೆನೆಗಲ್ಸ್ ಗ್ಲೋಬಲ್ ಆಸ್ಪತ್ರೆಯ ಸರ್ಜಿಕಲ್ ಆಂಕೋಲಾಜಿಸ್ಟ್ ಸ್ತನ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರಾದ ಡಾಕ್ಟರ್ ಮೋನಿಕಾ ಪನ್ಸಾರಿ ಅವರು ಸ್ತನ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಜಾಗೃತಿ ಮೂಡಿಸಲು ಹಾಗೂ ಮಹಿಳೆಯರು ಯಾವ ರೀತಿ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ತಿಳಿದುಕೊಳ್ಳಬೇಕೆಂದು ಉದಯ ಸುದ್ದಿಯೊಂದಿಗೆ ವಿಶೇಷ ಸಂದರ್ಶನದಲ್ಲಿ ತಿಳಿಸಿದರು.
Hello everyone, I am Dr. Monika Pansari. I am a surgical oncologist at BGS Gleneagles Global Hospital. I mainly deal with women cancers, that is breast and gynac cancers, which includes cervical, uterine and ovarian cancers. In our hospital, we have a huge team of surgical oncologists with organ specific distribution. What basically cancer is? Our body is made up of smallest building block, we call it cell. Cells usually undergo cell division, cell cycle and cell death in a controlled manner. Many times because of certain factors, these cells, they start behaving abnormally, start multiplying irregularly, and this uncontrolled cell division leads to the formation of a tumor, which could be malignant and non-malignant as well. That is cancerous or not cancerous. So if a tumorous or a cancer arising in the breast, we call it as breast cancer. Broadly, breast cancers are of two types. Cancer arising from the milk producing ducts of breast, we call it as invasive ductal carcinoma, and a minority of cancer arising from the glandular tissue of the breast, we call it as invasive lobular carcinoma. Now when we come to the risk factors for breast cancer, we broadly divide these risk factors into modifiable, that is which can be controlled by us, and non-modifiable, that is which we cannot control and which we cannot modify in our routine, in our lifestyle. So what are the non-modifiable risk factors for breast cancer? Like advancing age, female gender, having menstruation before the age of 12 years, having menopause after the age of 50 years, genetics, which obviously these are the important factors which we cannot have any control on. So these most important, as I said, genetics, around 5 to 10% of breast cancer could be genetic. So these are certain risk factors which are non-modifiable. So what are modifiable risk factors? Modifiable, as the name says, that these are the factors which we can control in our lifestyle, which includes unhealthy dietary habits, eating a lot of junk food, including red meat in your diet. These are few unhealthy dietary habits leading to obesity, increased body weight, not doing exercises regularly, can put a person at an increased risk for developing breast cancer. Other factors are increased consumption of alcohol, smoking, use of hormone replacement therapy in postmenopausal women, radiation exposure. All these things can increase the risk of breast cancer, and these are all the risk factors which obviously we can modify in our lifestyle. When we talk about breast cancer, there are few important personal and family history which again it's very important for all of us to know. What about the personal history? Like having first child after the age of 30, not lactating your child. Lactation always provides protection against breast cancer. It is said that lactation for a duration of 1 year can reduce the risk of breast cancer. So non-lactating women, nulliparous women those who have not married and they didn't have any child, can put them at increased risk for developing breast cancer. Consumption of sometimes oral contraceptive pills continuously for a duration of more than 5 years can also increase the risk of breast cancer. So these are few modifiable risk factors which of course in our daily life we can take care and reduce the risk of developing breast cancer. Having said that, even though we know that there are various risk factors for breast cancer, it is not that the individuals who are having these risk factors, all of them are going to develop breast cancer, and vice versa. Those who don't have risk factors, maintaining healthy lifestyle, they are not going to develop breast cancer. So basically there is a complicated mechanism between all these environmental, lifestyle factors along with your genetic factors which contributes to the development of breast cancer.